Karen Greer has been leading our live vaccine coverage all day long.
Karen, you are inside Georgia's Poison Control Center, and you've been there since 8 o'clock this morning. You've got a very special guest with you this afternoon. Introduce us.
Yes, absolutely. Dr. Gaylord Lopez, who has been with Georgia Poison Control for like 3 decades now. People are asking at home, why Georgia Poison Control? Why are you taking these calls?
Yeah, we've had a long-standing relationship with the Department of Public Health, and when they come asking for help, we've got the infrastructure, we've got the people, so we've been able to handle these after-hour call centers and give the people of Georgia the information they need.
And we're talking about maybe 600 calls at this point. What is that like for your normal call volume?
Yeah, for a normal poison call volume, you're looking at 250 to 350 calls. So that's going on right now as we speak, in addition to the 600 or 700 calls that are coming in for COVID.
And the types of questions, the biggest things you're getting asked are what?
Yeah, a lot of it is, I can't get an appointment for that first dose, or now that I've got the second dose down the road, no one's calling me about when to schedule that, where do I get it, and they're really frustrated, and they need answers, and hopefully we'll provide some of these answers for them.
And Dr. Lopez, our numbers still not great. We're seeing a really high number of cases.
Right. Georgia still ranks above the national average when it comes to positivity rates. Worse yet, we rank number 5 in terms of hospitalizations around the country. So it's still a problem. It's important that if you're eligible for the vaccine, get it, because the consequences, we believe, are far greater if you have the disease and have symptoms as opposed to get the vaccine and only have side effects.
One of the questions we're getting, if I get the vaccine, does that mean I can't get COVID-19?
Yeah, there's a lot of confusion around that. In fact, it works as simple as this. The vaccine is not effective in preventing you from getting COVID. It is, however, important that the vaccine helps you combat the virus. So you're better equipped to combat the effects of the disease, but it doesn't mean you won't catch the disease.
And one of the things we're hearing, cuts down on hospitalization. So that is huge, because that's when people really run into trouble, when they have to be hospitalized.
That's right. What this vaccine will provide are tools that your body can then deploy when that virus comes a-knocking. And if we can combat those effects, we can minimize hospitalization, minimize effects, and hopefully get people out of the hospital even sooner.
Is any one vaccine better than the other? Moderna?
Right now, they're fairly equal. The only thing that's coming to market now are the one-shot vaccines, which makes it easier for people to be one and done. The studies are promising, but right now, they don't seem to be as efficacious. But again, it's early. We still have all year long to figure out what's going on. But here's my thought. Vaccine is better than no vaccine. If you have an opportunity to get it, get that vaccine, get in line, make that appointment.
Other big question, when can we get to 1B and the other folks on the list, like teachers?
Yeah, vaccine supply is limited, demand is high. You know, we're probably talking about another month or 2 before we get to those other stages. If people be patient, you've been talking to your audience, be patient. Hopefully get lucky, continuously check the website, because appointments do open up, because people do cancel. So be diligent in trying to get that appointment for yourself or for a family member.
And that's what's going to be really important at this point, just to be careful and just wait.
Correct.
You know, try and just be a little patient about this whole process, because it is working as best we can in the state with not as much vaccine available as other locations.
That's right. And what we've seen in other states that have had better success with vaccine administration, when we've seen vaccine administration in other countries, very good early results. So if you are eligible for the vaccine, try to find that appointment. It's important.
All right, Dr. Lopez, thank you so much once again. 1-888-357-0169. We are over 600 calls in the last 8 hours, so they will be open until 6 o'clock to take your calls. So please make sure that you get your answers here today or tomorrow. Write that number down. Very important for you to keep with you in case you do get any questions later. Sean, Rick, back to you in the studio.
Karen, thank you. And Dr. Lopez, thank you for that and for your many years of service. Just a reminder that our panel of experts is answering questions all day.